Una well done o. My name na Dr. Toyin. Today we go discuss wetin dem dey call cervical cancer. And I go tell you wetin cervical cancer be. I go tell you the risk factors. I go come talk about wetin dem dey call human papilloma virus. Then if you get this human papilloma virus, wetin fit make you get cervical cancer more? Then I go come talk how you go take know say maybe you get cervical cancer. Then I go come tell you ways when you go make yourself make you not get am, and even if you get am, wetin you fit do. Before I continue, if you know say you never subscribe to my channel, just stop this video now. You see that thing when dem say subscribe, make you just touch am. Why e good be say when new video come, you go come get alert. You go say, new video dey, make I come watch am. So as I don talk before, today I go discuss cervical cancer. The cervix na wetin dem dey call the neck of the womb, and if dem come see cell wey no dey good for there, na im dem say cervical cancer dey. In 2018, na im be number 4 for all the cancer in the world when dey common. E get one program when dem say by 2013 cervical cancer no go be problem. So that one dey make government dey try act on. So wetin be the risk factors for cervical cancer? One na the age at which you come start to dey do intercourse. If you do am early, your risk dey much to get cervical cancer. Second na how many people you don get intercourse with. If dem plenty, your risk of cervical cancer go increase. Number 3, if the person when you get intercourse with don get intercourse with plenty people, your risk go fit increase too. Then number 4, if you no dey use condom for intercourse, then the risk go plenty too. Human papilloma virus na group of more than 100 viruses, but inside that 100, 15 fit cause cancer. Out of the 15, 2 of them, type 16 and 18, na im dem dey call high risk, and that na because dem dey cause up to 3/4 of cancer of the cervix. This human papilloma virus na when you dey get intercourse na you fit get am. And when person don start to get intercourse, you fit get this infection not long after that time. This human papilloma virus, they say e dey fit cause cancer for mouth, for throat, for vulva, for vagina, for cervix, for penis, and for anus. For those when get this human papilloma virus, e get some things when fit make them even get the cancer more. Number 1 na when you get other sexually transmitted infections, things like human immunodeficiency virus and herpes simplex virus. Number 2 be say if to say you don born 5 pikin when be say dem ripe well, that one sef you fit dey increased risk of getting cervical cancer. If to say you dey smoke cigarette, you go fit get increased risk. Then e get those when they take oral contraceptive pills. If you don take am for more than 5 years, you dey increased risk of getting this cancer. Another thing be say if to say one of your family members, your close family members get am, you sef you dey increased risk of getting it. How you go take know say you don get am? 1, you fit not know sef, nothing, no shake you, no go just feel anything. Number 2, you fit see say you get pain for your pelvis, or when you get intercourse, pain dey. Number 3 na when you get vaginal discharge, when they smell well, or when be like catarrh. Number 4 na when you get vaginal discharge when get some blood inside. Number 5 na when if after intercourse you come dey get blood. Number 6 na when in between your periods you go come dey get some blood. And number 7 be women when don reach menopause, when they come dey bleed again. How you go fit prevent this cervical cancer? In most countries, then they give injection to girls and sometimes even boys, sometimes between the ages of 9 to 14. Then they give them the injection of the human papilloma virus. so that the body go fit fight this human papilloma virus, so that even if dem get the infection, dem go fight am, dem no go get this cancer. For some country too, dem dey also give the boy the injection. Remember I say even the partner, if you get plenty sexual partners, e go fit make you get this cervical cancer. So e good make dem give both of them, so that the risk go go down. Also, if you fit do wetin dem dey call cervical smear, when be say dem go put something inside your vagina to open am small, so that dem go fit see this cervix well well. Then dem go come use something wey dey like feather or one small wood to come collect the cell wey dey that place. Then dem go come look am under microscope to see the one wey don bad. So it depends which country you dey, the age when you fit do am, e dey change. If you say you dey England, from when you be 25 to 49, you fit do this thing every 3 years. Then when you be 50 to 64, na every 5 years. If dem call you to do this cervical smear, abeg go do am o, because at least you go fit find the thing on time before it become very bad. Also, if you fit use condom, abeg dey use condom, so that you go prevent yourself from getting it. Also too, make you try stick to one person, because if you dey go round, you fit increase your risk. If to say you don't even get this cancer, no problem, dem fit do surgery for you, or dem fit give you medicine, or dem fit give you wetin dem dey call radiotherapy for you. I hope say you don enjoy this video. No forget to subscribe to my channel. Make you watch this video again, come share am. And until next time, smile, because e dey healthy well. Una bye bye.